Blood transfusion is the process of transferring blood products into one's circulation intravenously. Transfusions are used for various medical conditions to replace lost components of the blood.
First, we need to verify. Prior to the procedure, first we need to verify the medical order for blood transfusion. Then, the completion of informed consent. This means that the patient is informed about the risks and the benefits of this procedure. And the pre-transfusion medication. So, if it is ordered, we need to administer this medication at least 30 minutes before the transfusion. So, these medications decrease the risk for allergies and febrile reaction for the patient who has previous transfusion. Then, after checking the medical order, we need to gather the equipments needed for the procedure and place it at the bedside table. So, here are the equipments needed for the procedure. So, this is our blood product which is obtained from the blood bank. So, the transfusion must begin within 30 minutes. Within 30 minutes, if the blood product is obtained from the blood bank. Okay. So, after gathering the equipments, we need to perform hand hygiene and wear the PPE. This is to prevent contamination, and PPE is required for transmission precautions. Okay? So, assume that I already done hand hygiene. I'm gonna wear the face mask. Then after this, we will check the patient. Good morning, ma'am. I am Nika, your nurse attendant for today. Can you state your name and your birthday? Okay. So, we need to verify our patient, of course, to ensure that the right patient receives our intervention. Then, so ma'am, kamusta po ang pakiramdam ninyo? Nahihilo pa rin po ba kayo? Or may nararamdaman po ba kayong sakit? Okay. So, in order po ng doctor ninyo na magkaroon or mag-undergo ka sa blood transfusion. So, sasalinan po kita ng dugo ngayon. Okay, so, nasubukan nyo po bang masalinan ng dugo noon? Okay, so, sasalinan po kita ng dugo. This is to restore yung blood loss ninyo. Okay po ba yun? Naintindihan niyo po ba, ma'am? May mga katanungan po ba kayo? Okay, so, habang sinasalinan po kita mamaya ng dugo is, i-report niyo po sa akin kung may nararamdaman kayong kakaiba, like chills, itching, irritation, rashes, or other unusual reactions. Okay po ba, ma'am? Okay, so, prior to the procedure, I've already closed the door to provide privacy for the patient. Okay. So, ma'am, mag-relax ka muna dyan at i-validate po muna namin itong infos ninyo, okay? So, two nurses will validate the informations. Okay, so, medical order for transfusion of blood product, informed consent check, patient identification number. Okay, ma'am, let me check your identification card. Okay, patient name, blood group and type, AB positive. Okay, so expiration date. So, after 35 days, the red blood cells began to deteriorate. So, we need to check for the expiration date of the blood product. And then, inspect blood product for clots. So, We need to inspect the blood product for clots. If clot is present, we need to return it to the blood bank and obtain a new blood product which is of course compatible for the patient. Okay. So, the identity check between the patient and the blood component is very crucial. This is the final opportunity to avoid the fatal mistransfusion. Okay, so after validating the data, okay, we will wear gloves to avoid contact with blood. Okay. So, before the blood transfusion, we need to check the vital signs of the patient, especially the temperature, which indicates the presence of hemolysis. Okay, so the importance of checking the vital signs, of course, if any changes from the vital signs was shown during the procedure or the transfusion, this may indicate adverse reaction. So, let's check. Ma'am, check ko lang po yung temperature niyo. Okay. Okay. Then, let's start the transfusion. Okay, so this is the blood transfusion set. We need to close the clamps, all the clamps. So, this is a normal saline 0.9% solution. This is a solution choice for the blood transfusion. So, hindi po natin ginagamit ang mga solutions that contains dextrose because this may lead to hemolysis or the clogging of the red blood cells or the blood. Okay, so let's remove the cap. First, let's remove the cap of the spike. So, avoid touching the empty site to prevent contamination. Okay, so using pushing and twisting method, let's spike it. Okay. Then let's open the clamp. Of course, the other clamp. And then prime the tube. then after priming, we need to close the clamp sa may saline side, and of course close the clamp of the transfusion side. Okay. So here is our blood product. Open the clamp to allow the blood to So, let's start to administer the blood. Okay. So, we need to adjust the flow rate until the prescribed rate is achieved. Okay. So, for the first 15 minutes, we need to observe the patient for any adverse reaction. Okay, then let's check for the site for any infiltration. So, ma'am, masakit po ba? May masakit po ba kayong nararamdaman? Okay, wala. So, we need to observe the patient for flushing, dyspnea, itching, rash or hives, and other adverse comment. So, if we observe any adverse reaction, we need to stop the transfusion, and the blood product we will return the blood product to the blood bank, and of course we need to report this to the physician. Okay. Then, after 15 minutes, we will increase the flow rate of the blood. Okay. This is to we need to increase the flow rate, of course, para matapos kaagad yung ating blood transfusion na kailangan matapos siya within 4 hours or no more than 4 hours. So, ito yung kanyang required na time frame. Okay. Then, after 15 or every 15 minutes, we need to check the vital signs of the patient. Especially, kasi sabi ko kanina, the temperature which indicates that the patient has hemolysis. So, ma'am, masakit po ba? Wala naman po kayong nararamdaman na kakaiba? Okay. So, after or if the transfusion is complete or finished, so assume that the blood transfusion is finished, let's close the clamp sa ating blood product. Okay, ayan. Then, we will open the clamp sa ating saline side. So, when all blood is or was infused into the patient, we will close the clamp. Okay. Then we will remove it. Okay. And if the patient has an IV infusion or administration, kailangan nating ibalik yun. So, my patient has no IV infusion or hindi siya kailangang ilagyan pa ng IV infusion. So, we will dispose the blood transfusion equipment sa proper disposal or kailangang ibalik sa blood bank based on the agency policy. So, let's position our patient to a comfortable position. Ma'am, ayos lang po ba yung kalagayan niyo? Wala po bang masakit sa inyo? Okay, very good. So, gusto niyo po bang itulungan ko kayong humiga or uupo na lang po kayo? Okay po, so comfortable po ba kayo sa ganyan? Sa pag-upo ninyo? Okay lang po ba kayo sa position na yan? So, kung meron pa po kayong katanungan or meron po kayong kailangan, is ipatawag nyo lang po sa nurses ward at andun lang po ako. Pupuntahan po kayo dito. Okay po ba yun, ma'am? Okay, so, pagdadasal po natin, ang madali ang paggaling ninyo. So, next use lang po yung sarili ko. Okay po? Sige, ma'am. God bless po. Okay, so, after that, we will remove the PPEs, gloves, and the face mask. Then dispose. Then after removing it, we need to perform hand hygiene. So, for disposing the PPE, of course, to prevent the contamination, and hand hygiene prevents the transmission of microorganisms. Then after that, we need to document the procedure that we've done for today. Okay, so that's all for the blood transfusion.